So today I'm going to be discussing about the difference between trigeminal neuralgia and temporomandibular joint disorders. As I discussed in my previous video that many times temporomandibular joint disorder patient can get misdiagnosed as somebody suffering from TMJ ankylosis. Now the similar situation can happen with neuralgias, because many times actually temporomandibular joint disorder is a diagnostic dilemma. And the presentation clinically, when the patient comes to us, there are many times that these patients do get misdiagnosed as suffering from trigeminal neuralgia, mainly because the pain pathways or the pain dispersion in such patients is quite confusing, and the pain may be on the face or even towards the eyes, headaches. So many times these patients undergo a lot of investigations, and they undergo the MRI for the brain, where they looked into the presence of trigeminal nerve and its pathway, and whether it's compressing on certain important structures leading to neuralgia. Now, how do I differentiate whether it is a trigeminal neuralgia or a temporomandibular joint disorder? So most importantly for me, if it is a young patient, then I will not be thinking about trigeminal neuralgia. Mostly my diagnosis right from the beginning will be tilted towards the temporomandibular joint disorders, because neuralgias are something that are not commonly seen in young patients. It's more of elderly phenomenon. As we grow older, maybe 50 or 60, that is when we see more of neuralgia. So if I have a young patient, and if she's a young woman, then I will be more inclined to think about TM joint disorder. At the same time, if there is a history of jaw clicking or painful mouth opening or ringing sounds in the ear, then again I will not be thinking about neuralgia. I will be thinking more about temporomandibular joint disorders. So similarly, in TM joint also, people who have been treating it, they know very well that it's not just the joint but also the musculoskeletal structure. So it's always a musculoskeletal structure. So it's always joint as well as the muscles which are involved. And the muscles are attached, all the muscles are attached and are overlapping with one another between the neck and the face and the back, So most of the time this pain does get referred from the neck to the head to the sides. So this is something that is very commonly seen in TM joint conditions, and hence the diagnosis for those people who have not had the experience of treating these patients may think in terms of neuralgias, which is more serious diagnosis, more serious as well as more straightforward in so many ways. Neuralgia is much more straightforward. TM joint disorder is not that straightforward. So I would say that in case if you have been given the diagnosis of trigeminal neuralgia by one of your doctors, don't take it very seriously. Take it with a pinch of salt and consult somebody else. Take another opinion and get it sorted. So as the dictum goes in medical science, common things happen commonly, rare things happen rarely. So in a younger age group with a woman, the common diagnosis is TM joint disorder and not trigeminal neuralgia. So it is a rare diagnosis, and I wouldn't want to consider a rare diagnosis when I have not ruled out a common one. I hope this helps. Thank you.